Good morning. First of all, thank you for giving us the opportunity to share our project with the AF Association. Our project is entitled Doing Simple Things Well, Practice Advisory Implementation Reduces Atrial Fibrillation After Cardiac Surgery. I have nothing to declare. Atrial fibrillation after cardiac surgery is the most common adverse event following heart operation. Across numerous studies, the incidence of AF is reported to be between 30 to 50%, depending on the type of surgery. Of all the cardiac surgical patients who experience postoperative AF, 94% develop it before the end of 7th postoperative day, with a peak incidence on postoperative days 2 to 3, making it a real perioperative problem. Atrial fibrillation after cardiac surgery is associated with increased morbidity, including postoperative stroke, sternal and respiratory tract infections, gastrointestinal, and renal dysfunction, as well as an eightfold increase in the risk of subsequent chronic AF. It is also associated with increased short and long-term mortality, increased length of ICU and hospital stay, and increase in the healthcare costs. Similarly, on the baseline audit that we've conducted in our center in 2018, we found that the overall incidence of atrial fibrillation after cardiac surgery is 35.4%, with pretty much the same incidence per surgical type as the published data. And due to the high incidence of atrial fibrillation after cardiac surgery, in 2019, the Society of Cardiovascular Anesthesiologists and the European Association of Cardiothoracic Anesthetists published a practice advisory for the management of perioperative atrial fibrillation in patients undergoing cardiac surgery. This is with the aim of improving the perioperative management of AF. The practice advisory summarizes the current best practices based on distillation of recent guidelines from professional societies involved in the care of cardiac surgical patients. Unfortunately, despite the international guidelines for AF prevention exist, recent study shows that they are poorly followed. However, the risk of not following the guidelines could potentially result to beta blocker withdrawal, which, as you can see, can increase the postoperative AF. Our audit confirms that patients who are receiving preoperative beta blockers but did not receive it postoperatively have the highest incidence of AF of up to 80%. So what's our solution? Using the model of improvement for iterative tests of change, we implemented the atrial fibrillation after cardiac surgery prevention care bundle with the aim of locally improving the adherence to guidelines. We did it by forming a multidisciplinary team consisting of surgeons and anesthetists of different grades, ICU nurses, and pharmacies. We designed it based on the recommendation of a recently published practice advisory using an easily recognizable graphical tool and following the care bundle design guidelines. We also presented it and discussed it with all the stakeholders prior to the approval. And the outcome is an easy to follow graphical tool, which we call the Prevention of Atrial Fibrillation Care Bundle. It identifies the patient, the setting, and the time it is most applicable. The bundle is subdivided into 5 pillars, focusing on beta blockers initiation or reinitiation, target electrolyte levels, fluid balance, pain management, and oxygenation targets, which are all based on the combined international and local guidelines. We implemented it by placing posters in every handover rooms and colorful laminated sheets of the bundle at every bed space in ICU. We conducted team teachings to the nursing team, as well as anesthetic and surgical trainees rotating through ICU. We also sent some constant reminders to all our consultants. To assess the impact of our project, we conducted a re-audit between May to July last year, including 206 patients, and compared it to the 178 patients from our baseline audit. We found that there are no significant differences in the patient demographics, relevant comorbidities, and procedures performed between the two groups. We also found that beta blockers were given to significantly more patients, and the number of patients who received the beta blockers on post-operative day 1 has almost doubled. The percentages increased from 37% during the pre-implementation period to 67% after we've implemented the care bundle. The incidence of AF is also significantly reduced on each post-operative day, and the overall incidence has significantly dropped from 35% to 23%. This translates into 191 fewer patients who develop atrial fibrillation annually at our center. AF incidence is reduced across age groups with a significant reductions on patient ages 65 to 75 years old. It is also significantly reduced for coronary artery bypass graft and aortic valve surgery patients, but not on patients with combined surgeries and mitral valve surgeries. However, this could only be due to the small number of patients undergoing these procedures during our audit. To analyze the possible implementation barriers, we recorded the reasons why beta blockers were not given on each post-operative day. This has helped us to continue to improve and adapt our teaching in our bundle. Overall, we believe that our project constitutes good practice because it follows the best practice international recommendations. It is fully applicable to our patients as we identified a high incidence of atrial fibrillation after cardiac surgery in our baseline audit. It involves all the team members looking after the post-operative cardiac surgery patients. It was developed and discussed with all the stakeholders within the post-operative cardiac surgery pathway prior to and during the implementation. And finally, it focuses on measurable and relevant patient outcomes, reducing morbidity, ICU and hospital length of stay, and potentially mortality. In conclusion, the implementation of the tool has led to changes in clinical practice, which will help minimize risk of atrial fibrillation after cardiac surgery, achieve better outcomes for the management of atrial fibrillation after cardiac surgery, improve patient experiences, and potentially reduce the hospital expenditures. Thank you.